Skipped heartbeat and palpitations may not be alarming. In fact, a lot of people walking around here don't even know, or they haven't noticed yet, that in the course of the day, their heart skips a beat sometimes. It's very important. In us healthy human beings, sometimes we go through a phase of anxiety. Sometimes stress takes over our lives. Sometimes depression. Sometimes we lose out on sleep or we have sleep deprivation episodes. Sometimes we go to a dehydration phase. Sometimes we take in too much caffeine. With that being said, the heart automatically palpitates temporarily. And then also sometimes the heart misses a beat temporarily. These are triggers that causes these palpitations and then these unnecessary skipped heartbeats. With that being said, these may not be alarming. Also, in the medical world, we have something called premature atrial contractions that happens in the upper chambers of your heart. We also call something premature ventricular contractions that happen in the lower chambers of your heart. These are early heartbeats that takes place, that fires the electrical system, fires the heartbeat, and then prematurely you could have unnecessary contractions. In the process, your heart may stop temporarily for a little bit, or it could pause a little bit. It's not alarming because with that being said, your heart pausing, it resets, and then it gets back to a normal sinus rhythm. It's very important. Premature atrial contraction, that's PACs, premature ventricular contraction, that PVCs, they could cause this temporary flutter, this temporary thumping in your heart. We have to pay attention to it. Now, somebody may ask me, why is it not dangerous then? It is not dangerous because you don't have any chest pain or angina. It is not dangerous because you don't have any fainting episodes. It is not dangerous because you don't have any unnecessary myocardial infarction or heart attack or unnecessary cardiac arrest in the family history. So with that being said, we could check the evaluations and we could see that it is not dangerous. Okay, it may be dangerous or it should be alarming, or you have to come for physical evaluation, cardiac evaluation, health evaluation when you faint, when you have shortness of breath, when you are having this syncope or fainting spells, when you are actually going to cardiac arrest episodes, or maybe when you are having heart attack symptoms. That's when it is alarming. The palpitations or the skipped heartbeats are happening for a longer period of time in the day. Then it is alarming. Other than that, that temporary feeling is not alarming. That small episode of stressful or that small episode of missed heartbeat may not be alarming. But when it happens in the course of the day too many times, then you should come for the hospital evaluation.